Welcome back. Here we talk about carotid artery disease, not coronary artery disease. So the first question is, where is carotid artery? What does it supply? What happens if carotid artery is damaged? Okay, here you have a beautiful illustration that basically summarizes blood supply to the brain. If you were to trace it from the aorta, you have to stop at the aortic arch, then look at the second branch, the middle one, called a left common carotid artery. Okay, common carotid artery is given that name because it's the fusion of a few vessels, and it's now a common one. But as it ascends upwards, it's going to become two vessels, that is internal carotid and external carotid. External carotid artery, which we will not discuss in detail here, is the one that supplies the outside the structures of the brain, such as the skull, okay? So the face and so on. So we will not worry about external carotid anymore. We will talk about internal carotid artery. Internal carotid artery is the one that reaches the brain, branch off to become three major arteries: anterior, middle, and posterior cerebral arteries. You notice here, posterior cerebral artery, middle cerebral artery, and anterior cerebral artery. So this ring, okay, is created by who? The internal carotid artery. All right, now let's focus on yet another blood vessel, another artery that is branch of the subclavian artery. Okay, subclavian artery. This is our third vessel in the aortic arch. It's called left subclavian artery. If you're following the left side, on the right side, what happens is brachiocephalic artery will branch off to become a right common carotid and right subclavian, and that's how you have the equal distribution of vessels from that point on. Okay. Anyhow, we are talking about vertebral arteries as one of the branches of subclavian artery. It first supplies the spinal cord, the cerebellum, and then it ascends upwards. Notice here. And vertebral artery together, okay, the right and the left fuse to become basilar artery. Basilar artery now reaches the rest of the arrangement that we talked about and then form this ring. Okay, this ring. This one is called circle of Willis. Circle of Willis is pretty much to refer to blood supply to the brain. Okay, this ring-like arrangement has an advantage. That is, if one of these vessels, either the vertebral artery or the internal carotid artery, one of them were damaged, then the other one is supposed to keep up with some blood supply, if not all. So that is a protective measure that's built into this design. Okay, good. So we talked about blood supply to the brain. And now we talk about carotid artery and how that can be responsible for stroke. Okay, damage to carotid artery, any disease in carotid artery, atherosclerosis, aneurysm, thrombosis, embolism, any of that could lead to cerebrovascular accident, commonly called as stroke. Okay, about 3% of the population suffer from stroke. There are different types of strokes. I have listed a few here. Ischemic stroke is the most common kind. That could be due to thrombus or an embolism in the carotid artery. Okay, the way it works is blood supply is cut off, a particular part of the brain becomes ischemic, and then the cells die. Neurons do not switch to anaerobic respiration at all. So when there is no blood supply, no oxygen supply, that area becomes a waste. So that is infarction. Okay, 87% of the strokes are ischemic strokes. Hemorrhagic stroke, this is where you may want to think about hypertension and the blood vessel being ruptured, and that would cut off blood supply to that particular part of the brain, as well as the blood that's released locally can disrupt the area and interfere with the function of that particular part. So hemorrhagic stroke is also a pretty intense one. So now yet another one is transient ischemic attack, TIA. Transient tells you that it is temporary. Okay, so yes, this is where a person goes through the signs and symptoms of stroke, loss of function temporarily. You know, it could be the left side, right side, or other muscles being affected. It's basically related to some sort of obstruction that cuts off blood supply temporarily, but then it gets reinstated, so things become numb. There are very high chances of transient ischemic attack becoming ischemic stroke within a year or two. Okay, so although this is not the nervous system, it is brought in here. This topic of stroke is brought in here to discuss the blood supply to the brain and the importance of carotid arteries and the most common carotid artery disease, stroke. All right, thank you.